Welcome to A Mindfulness Experience with access to Integrative Medicine Health Institute, the GW Office of Integrative Medicine and Health, and the GW Resiliency and Well-being Center. AIM is the first 501c3 nonprofit in the DC metro area to provide integrative medicine services to low-income and terminally ill patients, regardless of their ability to pay. The office is a global leader in integrative medicine, focusing on professional development and community outreach. The center takes an evidence based whole person approach to the health wellness services it provides exclusively to the School of Medicine and Health Sciences, GW Medical Faculty Associates, and the GW Hospital. Today we have with us Dr. Calvin Richards, who is a naturopathic doctor and physician assistant who specializes in integrative and functional medicine at the GW Center for Integrative Medicine. And to do our mind body practice, we're bringing back Dr. Michelle Clausen, who is a primary care research training program postdoctoral scholar and nurse midwife with the GW Resiliency and Well-being Center at the GW School of Medicine and Health Sciences. So, Misha, what's going on in the world?
Well, too much. So if you're very stressed out about all kinds of stuff that's happening, I totally understand. But Michelle will help us with that today. Thank you, Calvin and Michelle, both of you guys for being here today. So I have a couple of updates. Unfortunately, my hope for Novavax being an option seems like completely unrealistic. RFK just basically said you have to do a randomized controlled trial. Doing randomized control trial on any vaccine will take probably, 3 months is really pushing it realistically. We're looking at 6 months. So there's nothing going to happen for this fall. And moreover, it appears to be pretty clear they're actually going to stop covering the COVID shots, and they're probably going to remove them from the recommendations completely. In fact, it's not even clear whether the shots will be available whatsoever. It appears, the way I'm reading literature, they're basically saying you're going to all have to do randomized controlled trials now, and without that, we're not going to get you any approval. So what will happen by the fall, I have no idea. Don't ask me to speculate. Don't ask me for what to do for you personally. I have no idea. If they're going to remove some vaccines and leave others, it's going to be one scenario. If they're going to remove all the vaccines and say nothing is available whatsoever, it's completely different. What would be the result of it? God knows. So, on a positive note, the overall prevalence seems to be stable or declining slightly. So it doesn't seem like it's hopefully for this, well, in the summer, it's not going to change. We know that. What will happen toward the fall, we're going to have to trace this. Okay, I have a couple other quick updates. So one, those of you who've been seeing this new TikTok trend of drinking olive oil, a shot of olive oil daily, and wondering what is this all about? Let me put this article for you from Women's Health Magazine, which is actually a quality magazine. So this is from UK. It's a reasonable thing. I recommend all my patients to make sure you consume olive oil daily and high quality olive oil. And here, this journalist actually just was drinking a cup or a small cup, an ounce, so the shot of olive oil for 2 weeks, and reporting benefits. If you're going to do this, which is completely reasonable, I would definitely suggest a very high quality organic olive oil. There are unfortunately a lot of really low cost and poor quality olive oil, which I wouldn't recommend. So that's an interesting, and what's the benefit? Well, it's pretty obvious, right? So olive oil is very high in antioxidants. It has a polyunsaturated fatty acids, what's called an omega-9 fatty acids, which are considered anti-inflammatory and also regulating for the immune system. They also tend to give you very high quality calories, right? So you get a good chunk of calories, which are not going to convert in your blood into the sugar, thus not contributing to any sugar problems in your blood, pre-diabetes and things like this. It's also a misunderstanding that you can gain a lot of weight from drinking olive oil. That's not going to happen, mostly because this is, again, you're gaining weight primarily from the carb intake or protein intake when you are getting that converted into the basically directly the weight gain into the fat. So fat that you take orally will not stay as a fat in your tissues. That's sort of misunderstanding. It's the carbs that will convert into the fat through the complex metabolic process. So that's one specific issue. And I think that's mostly what I was gonna do. I know I'm supposed to record some videos. I haven't gotten myself. I've been quite busy dealing with some stuff. So it's on my to-do list to get some studies for you to be reviewed. Again, I will remind you that if you're interested in that CAT scan study that I did finally put on our YouTube channel, it's up there now. So by all means, go ahead and check it out and feel free to watch it. Also gonna remind you that we have some other new videos there, including interview with our latest and greatest, Linda Taylor, who is Pilates instructor and individual Pilates instructor, and also with our newest doc, Dr. McDur, who is a gynecologist who's been joining our practice. He's already joined. He's basically starting to see patients very soon in the next couple of weeks. So if you're interested in seeing what he does, here's the YouTube video for you. Take a look. And with that, let's do Q&A. You know the drill. It's best if you type the question. If for whatever reason it's hard for you to do, please by all means raise your hand and we'll make sure we unmute you. Okay, can you overdo omega-3? Yes. You're not going to overdo omega-3s, but what happens when you take too much omega-3s, you become omega-6 deficient. And omega-6 pseudodeficiency is much more concerning, in my opinion. In fact, I see more and more omega-6 deficient patients. Is not to be confused with a beta omega-6. There are really good omega-6, particularly something called gamma-linolenic acid or GLA or DGLA. Those are really critical as an anti-inflammatory, and if you don't get them enough, relatively speaking, you're actually going to have some issues. So you can overdo omega-3. It's not recommended to take some crazy doses if you are eating fish 3 or 4 times a week. Oily fish, you're probably going to get enough just from food, although not everybody. So monitoring omega-3, omega-6, omega-9 levels is wise. And as you know, of course, if you're my patient, there's a good chance we already checked yours. Great question, by the way. Almond butter as a snack, probably not going to have a lot of omega-3s, Randy. I think it's probably going to be more polyunsaturated fats, like in an olive oil. So you're probably not going to get overdone on that. Flaxseed oil extracts could potentially do that, but you will have to take omega doses, like a cup a day or something. That doesn't worry me much. It's not that easy to overdose omega-3. The only people who truly can overdose if you're taking a fish oil extract at much higher dose than generally recommended, I wouldn't do that. I think that could land you in some issues potentially. I mean, it makes perfect sense, right? So Linda, to your question, any exposure to plastics is likely giving you microplastic accumulation, so it makes perfect sense. So minimize it. I mean, I think one thing I will say, we do use Ziplocs at home. We tend to use them, we never heat them up. We tend to use them more in the refrigerator. Remember, when the temperature is lower, your exposure is going to be lower, right? When the plastics are at the cooler temperature, they're going to be exposing you less. I also will say that don't put hot liquid in a Ziploc and then put in a fridge. Never put anything hot in a Ziploc, especially liquids that will absorb microplastic faster. But it's a really good question. So yeah, in short, honestly, I feel like it's nearly impossible to be very, very strict on all this, because think about this. You look around you and, half of all the materials are now plastic. How are we realistically? Just do your best. I mean, unfortunately, let me give you simple advice, because I was just reading this on the news. Those paper receipts we get printed on receipt machines? Never have them. Just don't. Just it's easy to now say, I'm not going to take paper receipts. That paper that's kind of glossy, that is a highly absorbable microplastic on a paper. Don't touch it. So don't accept the receipts in the gas stations. Don't accept them anywhere. Just ask, I want digital receipt if you need a receipt. you don't really need a receipt. Like if you have it on a credit card, I mean, you're gonna have a credit card receipt there. So if you're afraid they're going to charge you something different, okay, be my guest. But again, ask for a virtual receipt rather than a paper receipt. And I'm not talking about just saving the planet, paper cut, the trees, and I'm actually saying touching those things. They're very easily absorbed. Like there's a good data on that. So that's an easy one to avoid. Okay, and that's the next question. Where are we here? Please discuss getting olive oil from sauteing your food, which means consumers. Yeah, so one thing is when you're cooking with olive oil, make sure it doesn't burn. If it doesn't burn and you're not cooking at the very high temperature, it's perfectly fine. I would that's what we do in the home. We do cook primarily with olive oil unless we're frying things. If we're frying things, we use either ghee, coconut oil, and a couple other fully saturated fats, which are much more stable. They don't burn as easy, right? So don't fry with olive oil. Olive oil will burn pretty quickly. Even the one that it says non-virgin, so like a regular olive oil that's supposed to be more stable, even that is not stable enough to use for frying, just saying. So, Cecile, I don't know what the question is. Have you B complex supplement to recommend? Yes, we have a lot of B complexes. I'm not sure what specifically you're asking there. Okay, how high is too high for fish oil extract? I would say there's no reason to take more than 3 grams of DHA EPA combined per day for almost everybody. There are rare situations where taking a lot more would make sense. You would need to discuss this with your healthcare practitioner. One of the big problems if you take a lot of fish oil is bleeding, because it becomes a blood thinner at the very high doses. Again, we're probably talking 4, 5, 6 grams of DHA EPA. If you look at the typical capsule of DHA EPA, average will have probably 3, 4, 500 milligrams. Very high quality brands will have a 1 gram per capsule. So if you're taking an average, you will need to take 10 capsules before you're going to start getting in trouble per day. That's a lot of capsules. Okay, I always wonder about heating olive oil too. Yeah, so agreed. Well, if you're heating at low temperature, like sauteing for a quick period of time with some other, like with water, if you have vegetables that are very juicy and they're going to leak the water and it's just kind of boiling process, that's okay. That's not very high temperature. Olive oil will still be relatively stable at that temperature. We're particularly talking about when you're frying, like, cooking anything that has a high heat and you start seeing a smoke coming up, that no BNO. Okay, so cut that out. Use the saturated oils I mentioned. We use a lot of ghee. Why? I don't know. Coconut oil. Well, first of all, my wife has an elevated cholesterol, so we're trying to cut down on that. So actually, ghee is better for cholesterol than coconut oil. Although I don't know. I mean, probably it's a minor difference, most likely. And also coconut oil often has residue, and you don't want to cook with MCT oil, also not stable enough. And frankly, it's too expensive. It's not a cooking oil. And I think ghee tastes better also. So yeah, you can get avocado oil. I also agree it's hard to find a very high quality avocado oil. I don't know, for some reason we've used it before. This whole idea that seed oils are not very good, I don't know how much it applies to quality avocado oil. Definitely don't use grapeseed oil. There was a period where everybody was using grapeseed oil and we were using it too. I would not use that anymore. I think the data is now pretty clear. Avocado oil is okay. We choose to use ghee, but again, if you're really concerned about your cholesterol, you really have to stick with the least saturated option. I think avocado oil is a good choice. I support that. Okay. So if you want to re-ask your question of B complex, be my guest, but we're out of time. So if you do want to ask that me in person. So I'm sorry, I took a little bit extra time. And let's pass it on to Dr. Richards. I don't see Kelvin here, but I hope Janet can help me to get him.
Here.
There you are.
Yep.
All right, let's pin you to the screen. Everybody can see you? All right, great. All right. Thank you for being here, Kelvin, and take us to your wisdom.
Well, thanks for having me. I'm Dr. Calvin Richards. I'm a naturopathic doctor and PA here. And I'm going to talk to you today about peptides. Can you still see my screen? Hopefully you guys can.
Yeah.
That's great.
Okay.
Perfect. All right. So peptides, they've been in the news lately, mostly for like Ozempic, Wegovy, semaglutide, tirzepatide are some common peptides that people are familiar with. If you haven't heard of the category peptides, we all create them in our body. So one example of a peptide is insulin, discovered back in 1920. This is a picture of the insulin molecule. This is pro-insulin, actually. So when insulin is being used by the body, it cleaves off this C-peptide, and we use these chains right here. So that's a common peptide. Peptides are basically small proteins. They're about the size of 50 or less amino acids. This picture right here is a representation of the common 20, 21 amino acids. And let's see, peptides are used for a myriad of ailments, ranging from weight loss, blood sugar control, all the way to certain antibiotics. So there's natural peptides and synthetic peptides. Um, the peptides that I selected in this presentation were peptides that are more readily available by certain compounding pharmacies. The landscape of peptides changes rapidly. I first got into peptides about 9, 10 years ago, and the peptides that I used then, some of them are no longer available. Some of the ones that I talk about, they've been around since then. Okay, so first peptide, GLP-1 agonist. That's the one that's in the news a lot, the semaglutide, the Wegovy, the Ozempic. And like I just mentioned, the landscape of peptides are changing. It's getting a little bit harder to get the compounded semaglutide, tirzepatide from your compounding pharmacy, but still available. It's just the legal landscape is changing. So what is this used for? Typically used for type 2 diabetes, helping to control blood sugar and also weight loss. In this talk, I talk about indications. That basically means what is it used for. Contraindications is who should not use it. And then mechanism of action is how it works. And I tried to simplify these. So basically, contraindications who should not use the GLP-1 agonists, certain types of cancers. So medullary thyroid cancer, multiple endocrine neoplasia type 2. Alrighty, and then how does it work? Stimulates insulin secretion. So when you're stimulating insulin, it helps lower blood glucose. Also suppresses a hormone called glucagon. Glucagon rises when we're hungry, when the body does not see enough glucose circulating. This in type 2 diabetes, insulin and glucagon can be dysregulated, and the semaglutide can help suppress that, so you're not producing more glucose even though your glucose is high in the blood. It also works by decreasing appetite, slows stomach emptying, which also makes you feel full too. Alrighty. So benefits, what they're finding, cardioprotection from using the GLP-1s, kidney protection, has anti-inflammatory effects. I think this is in part by the medication itself, but also by the fact that people are losing weight, losing significant weight. Fat, adipose tissue is pro-inflammatory, which can have issues with the heart. If your blood sugar is elevated in type 2 diabetes, that can also lead to kidney damage. So I think it works by two ways: by lowering the fat content, blood sugar, and then direct stimulation of the receptors on various organs here. So this picture just represents where the GLP-1 receptors can be found in various parts of the body and different organ systems. Alrighty, so Samorelin, this one may not have heard of. About 10 years ago, I started using this with patients. Samorelin is used, I use it a lot in my more mature patients that have muscle loss or low bone density. It helps secrete growth hormone. As we age, growth hormone can decline. You can get sarcopenia, decrease muscle, decrease bone. And that's typically what it's used for off-label in functional medicine areas. It can be used for growth hormone deficiency in little kids, and it can also be used as a diagnostic tool to see what's going on with growth hormone and where the deficiency is coming from. And then who should not use it? People with active cancers or intracranial lesions. Growth hormones responsible for causing things to grow. So if you already have a condition where things are growing rapidly, you probably don't want to use it. Other situations where you don't want to use it in hypothyroidism. I had to do a little bit of digging why it was contraindicated with hypothyroidism. But what I found was secondary hypothyroidism, basically due to thyroid releasing hormone from the brain that then signals the thyroid to produce T3, T4, that or TSH. If you're having growth hormone, it can worsen that condition if there's an issue with the brain releasing the TSH or thyroid releasing hormone. And also, if you need T3, T4, those are the hormones released from the thyroid in order for growth hormone to work properly. So that's what it says is contraindicated in those in that condition. Might be a relative contraindication. So how does Samorelin work? It binds to the growth hormone releasing hormone, causing receptor, causing growth hormone to be released. But it does it in a way that maintains the pulse that we naturally have in order for growth hormone to be released. So if you give someone growth hormone directly, it can suppress the pulse that's needed for growth hormone to be released, and it can then suppress the release of growth hormone. So this works more naturally with the body, helping to raise growth hormone. There's some issues with Samorelin. I didn't type it in here, but you have to monitor prolactin and cortisol levels. So this is an older one. There's a newer one that I'll talk about in a second. So who does Samorelin benefit? People who are trying to increase lean muscle mass, decrease body fat, also helps with strengthening bones. These last two bullet points, I don't really use it for that. Enhance focus, mental clarity, and energy. But it does have some anti-aging benefits. It may slow age-related pituitary decline because of the growth hormone being released from the pituitary, and then improve sleep. I haven't really seen that one with patients to improve sleep. All right, so CJC ipamorelin is the more newer growth hormone releasing hormone peptide. It's used for muscle growth, strength enhancement, fat loss, recovery, acceleration, recovery not only for the gym, but for post-surgery and injuries. A lot of times they'll use this in functional medicine, anti-aging, for guys that are more mature, working out and getting sore, going to the gym regularly. They'll use the CJC ipamorelin with great results. Anti-aging helps with skin elasticity, wrinkle reduction, and there may be some cognitive benefits. Who should not use it? The same as Samorelin. If there's an active cancer, proliferation, pregnancy, other medications affecting growth hormone. So you wouldn't want to use this and Samorelin or growth hormone together because that would just be too much. And then CJC ipamorelin, it's an analog of the growth hormone releasing hormone, lasts about 6 days, and like Samorelin, also preserves the pulsing nature of growth hormone. But with this one, it doesn't affect the cortisol or prolactin as much. Benefits, body fat reduction, lean muscle mass increase, accelerates tissue repair, collagen synthesis, reduces inflammation, improves bone density, joint health. A lot of times I would use this. I remember one patient in particular after shoulder injury repair, he used the CJC and felt better with it. So I do like this one. It can be a little hard to find because the landscape of peptides is changing. And like I said earlier, for athletes, they use it for recovery after working out. And then peak results, it can take up to 6 months to work. So it's not something you're going to see overnight. Okay. PT141 from bremelanotide. The more common name that you can see and get a prescription for is Vyleesi. So this is used as FDA approved for basically low libido in premenopausal women. So hypoactive sexual desire disorder in premenopausal women. Off-label, it can be used for erectile dysfunction and for female sexual dysfunction. Who should not use it? People who have uncontrolled hypertension, cardiovascular disease, postmenopausal women and men with no sexual dysfunction, which makes sense because it increases libido. If you don't have an issue, then you don't really need it. How does it work? It goes to the brain, acts on receptors, changes neural pathways, changes some of the neurotransmitters that are being released, such as dopamine. It also enhances nitric oxide production and blood flow to the genital tissue. So that's why it can be helpful for erectile dysfunction in men. Benefits: increases libido, sexual desire in all genders, improves arousal, fast onset within 30 to 60 minutes. It can be a good alternative for people who cannot take or don't respond well for Viagra because of its indirect route on stimulating nitric oxide and blood flow to the region. All right, this one is a newer one, a GHK copper. So the GHK stands for glycine, histidine, lysine. This, I don't know if you guys can see because there's stuff on my screen here, but this is representation of the 3 amino acids that's used to make it. And then copper just sits right here in the middle. This one's more for anti-aging. It improves skin elasticity, firmness, clarity, reduces wrinkles. It may help with hair restoration. I have not seen this. Wound healing can help with tissue repair. And then these last 3 don't really use it for that, but there, I believe, are some animal studies that suggest that it can be helpful for neuroprotection, anti-inflammatory, and potential anti-cancer applications in the future. All right, so it really is this blue color. This is a representation. That might be the copper that's found in there. Its mechanism of action stimulates collagen growth, elastin synthesis. Antioxidant, it boosts superoxide dismutase, catalase, and those are 2 enzymes that have antioxidant ability. So it neutralizes free radicals. And then it suppresses some inflammatory markers, TNF alpha, IL-6, and then said to promote blood vessel growth, can modify some genes involved in anti-aging pathways and tissue repair, and then enhances nerve growth factor activity, reduces oxidative stress in neurons. Typically, how I've used this one is topical. So I don't know in the research how they're applying it to get the neuroprotection effect, but it's mostly for the anti-aging qualities in functional and anti-aging medicine. There's no explicit contraindication. There's maybe some mild irritation, redness, itching. And if you're allergic to copper or sensitive to copper, probably should not use. Okay. Thymosin alpha. That's the natural name. That's the natural peptide. And then the synthetic peptide is thymolphacin. This can be Thymosin can be used mostly for the immune system and modulates immune system function. So it can be used in chronic infections for hepatitis B, C, HIV, and sepsis. Can be an adjuvant treatment for melanoma. So basically, adjuvants help stimulate the immune system. So it can be used as an adjuvant in cancer therapy and in vaccines. As we get older, certain vaccinations can't stimulate the immune reaction necessary for immunity. So there's potential application in using it to improve the immunogenicity for influenza and other vaccines. And then there's some application of using thymosin for autoimmune disorders because of its immune modulation. So when I say modulation, it's not necessarily stimulating or suppressing. It changes depending on what the need is. So it can stimulate in certain instances, and it can suppress immune system in others. So I was surprised by this one. In COVID-19, there have been some studies in China where they use this to reduce mortality in severe cases. Like I said, these studies were small, and I believe they were not blinded, but it can mitigate a cytokine storm and restore immune function. Mechanism of action, I won't bore you with the details, but it works on stimulating various immune cells and maturation, especially T cells. It also can activate dendritic cells and basically cells that present the foreign body, the antigen. It can help with those. Okay. Alrighty, contraindication, if you're sensitive to thymosin, probably should not use. And then in immunosuppressed states where you need to be immunosuppressed, like you have an organ transplant, it's a relative contraindication. Unless the benefits outweigh the risk, then you use it. If not, don't use it. Alrighty, try to be cognizant of time, almost at the end here. Alrighty, so C-Link is the analog of Tufsin. Tufsin is a peptide that was discovered by Tufts University. The reason I have a picture of an antibody or immunoglobulin here is the C-Link is the analog of this region of the antibodies called the FC region. Although it's derived from an immunoglobulin or antibody, it's mostly used for mood. It does have some application with the immune system, but it's mostly used for mood. I've used this in a handful of patients. I haven't seen remarkable results with it, but it might have been a time limit not using it long enough. But it can be used for general anxiety disorder, other anxiety-related conditions, depression, mood disorders. Can be used for stress management. Those are what I typically, well, in the past have used it for. But through the research, it says that it can also be used for cognitive enhancement, improved memory, attention, learning, fatigue, and in chronic fatigue syndrome. Supportive therapy for immune modulation. I don't really use it for this aspect, mostly for mood. All right, so how does it work? So GABA receptors in the brain, when they're stimulated, it has a anxiety reducing effect. So benzodiazepines they bind to the GABA receptor too. This C-Link binds to the receptor in a different way than your benzodiazepines do. And it does it in a way that it's not sedating and it does not create dependence on it. So that's really good because that addiction can be a problem with the benzos. Alrighty. It also regulates the breakdown of certain neurotransmitters. It elevates the brain-derived neurotrophic growth factor, which is like fertilizer for brain cells. And then, so supports neuronal growth, survival, plasticity, and cognitive and mood enhancement. All right. And then this one, I included this picture here because this one's typically used as a nasal spray. The other ones that I talked about are mostly injections. And then contraindications, intolerance, pregnancy, age below 18. Alrighty, some great resources for more peptides. I included the peptides that were available to be used by compounding pharmacies, but the International Peptide Society is a great resource. Peptide Sciences, PubMed is a great resource. And then I included this journal, is an open access journal, because they were the ones who mentioned the use of C-Link or the use of thymosin in COVID-19 in small studies in China. Alrighty. That is all I have for you guys.
Great, thank you. Thank you so much, Kelvin. Very, very dense topic, fascinating topic. I'm so glad you recently joined. If ever, and by the way, I'll give everybody the link to your video in 1 second that you and I did. If you have a question or two, just for 1 minute, I'll give you guys a moment to ask. Otherwise, we'll move on to our mind body part. And meantime, I'll find Kelvin's video to put in the link for you. Right. So if you're interested in more in Kelvin's work, here's the link.
Calvin, this is Janet. Can you send me a copy of your PowerPoint so I can share it with the group?
Absolutely.
There's one question by Stephanie in the chat. Kelvin, can you see it?
I see it now. Okay, so are GHK, copper, and CJC applicable for EDS, Ehlers-Danlos syndrome? Are these similar to BPC 157? So that's a good question. So BPC 157 and CJC are similar to each other, and I believe BPC works on growth hormone receptors. The release of it.
Center for Integrative Medicine YouTube channel. So
Say that again, I couldn't hear.
somebody clicked your video, so if you guys please mute yourself.
Oh, okay. What I would do, I've never used it for EDS, but before using anything that releases growth hormone, I would check growth hormone first to make sure if there's a deficiency, because if there's no deficiency, then I'm not too concerned about it. But I would probably stick with the CJC, GHK, mostly used for anti-aging and wrinkles, because it's topical application. I haven't used it as an injection. Sorry, long answer.
Okay, friends, so if that's all we have for Calvin, let's switch over to Dr. Michelle Clausen, who is going to be leading our mind-body session today.
Thanks, Janet. I'm so happy to be here and guide you all through a little imagery meditation. These tend to be my favorite kinds of meditation. And I just wanted to talk about a little bit about quickly guided imagery for those who may or may not know, but it's a gentle and powerful technique, and it focuses on directing the imagination where all senses are engaged. You might have heard it be called visualization or mental imagery, but really guided imagery involves just so much more than the visual sense. It involves the whole body, and really it can be focused and tailored to your needs and what you're actually looking for and where you are. And there's a ton of evidence that has been established that demonstrates the positive impact of guided imagery meditation on health and creativity and performance. And we know that even just 10 minutes of this type of meditation and practice can reduce blood pressure, lower cholesterol and glucose levels in the body. So sort of connected to Dr. Richard's talk, and even some heightened short-term immunity cell activity. It can reduce anxiety, it can ease symptoms, particularly associated with chemotherapy, for instance, like nausea and depression and fatigue. And it's considered a right brain activity, so engaging in this type of exercise, you might notice is accompanied by other functions like emotion and laughter. You might feel sensitive to music. I'm going to use music in the background during this imagery. So hopefully that just helps to open the portal. It can open you to spirituality and intuition, and we're going to focus on that intuition. And the best part of this is that anyone can do it. You can invent your own imagery. You can listen to scripts. There's a ton online. And either way, your imagination is going to probably take over during this. You'll hear my voice, but really this script is just kind of a guide, an internal launching pad for your own genius and unique imagination. So let's get started. I'm just going to share my music and make sure that works. I'm going to start the music in a second, and I call this the Inner Guide Wise Guide Imagery, perfect for a Friday, with the goal to help us access our subconscious information and guidance. So taking a moment to just think about if there's something you need or something you've been searching for. This type of meditation fosters trust in our own inner wisdom, which we need now more than ever. And just a few cautions. It may evoke some strong memories. So just be gentle with yourself. And for folks, it's always important to say if you've recently encountered any trauma or have been recently traumatized, you might hear me say the word safe place, which can be a trigger. So I just invite you, if that doesn't feel possible, to think about the word safe maybe as a special place instead of a safe place or a comfortable place. So I'm going to go ahead and start my music so we hear this in the background. And I just want to just take a few cleansing breaths. I invite you to sit or lie in a comfortable position. It's nice to lie down if you don't fall asleep, but if not, just wherever you are. And I invite you to close your eyes and feel your body against the floor or the chair. And allow your body to soften and just let yourself be. And now allow your awareness to move to your breath. Awareness of the in-breath and awareness of the out-breath. Breathing in, feeling calm, and breathing out at peace. Preparing now to go on a mental journey. I would like you to imagine yourself in a very special place. It could be a real place, a place you might actually have been, a beautiful spot in nature, or perhaps a comforting place in your own home. Your special place may be an imaginary place, indoors or outdoors. And if more than one place comes to mind, and allow yourself to just choose one and just stay there. This is a place where you are comfortable, and it's a place where you are safe. Appreciate this scene with all your senses. See and touch and feel. Feel the whole environment that you are in. Hear the sounds. Smell the aromas. Feel the air on your skin. Experience the ground securely under you. Notice the time of year, the time of day. How old are you? Notice the colors that surround you and the temperature. Notice what you are wearing. If you have something on your feet, and whether you are alone or with other people. Notice the qualities of the place that makes it safe and comfortable, where you experience that safety and comfort in your body. And begin to look around you to notice if there's anything else that would make this place safer for you. Perhaps there's something that you need to remove, or something or someone that you need to bring in. If so, feel free to go ahead and do that now. And notice how your body feels in this place. And now, notice a shape or form slowly moving towards you or near you. This is your wise guide. Perhaps a person you know, or an animal, a color, or a presence. Perhaps it is a feeling. Accept whatever comes. Notice how old or young it is, how large or how small. This person or creature or presence is your wise guide, your inner self, your spirit guide, whatever name feels right for you. And as the being or presence approaches, by words or touch, introduce yourself and take some time to get comfortable in its presence. Does it have a name? Know that this wise guide is here to help you and to serve you. The wise being may have a message for you. Listen to it. Accept the message and learn from it. And feel free to ask questions for some advice or clarifications or a solution to a problem. Your wise guide may even have a gift for you, and if it's offered, you may accept it. Spend some time with your guide, enjoying being in its presence. take a minute or two asking whatever you have, accepting the answers, continuing to ask and receive answers. Now, in a moment, I'm going to ask you to say goodbye to your wise guide. Begin to give thanks, knowing that you can return anytime you need to. And begin to allow this image to fade. And when you are ready, at your own pace, become aware of yourself once again in your safe, comfortable place, relaxing there, noticing what you see and feel and hear. Rest here for a while. Now become aware of your breathing, deepening. Very gradually, let the awareness of your body against the chair or the floor return. And bring yourself back slowly and comfortably. Now, become aware of the room. And when you are ready, and only when you are ready, gently open your eyes. Take a little breath. You may want to spend a moment jotting down things that have come up during this imagery, because it often disappears from memory. And I invite those who want to share with the group perhaps this experience and anything that might have come up. Be happy and eager to learn what folks may experience.
Michelle, that was wonderful. Thank you. And
You're welcome.
I agree with Randy and Kathy wholeheartedly. Now, just a reminder, everyone, and thank you, Michelle, and thank you, Dr. Calvin. I appreciate both of you for giving us your time today. Reminder, we will not be meeting next week because it is the Memorial Day weekend. So I'm going to stop the recording and turn things over to Misha.